Hey guys, Tony Maritato here. So if I'm dealing with some plantar fasciitis or heel pain, pain on the bottom of the foot, let's talk real quickly about what we're experiencing and where. There's generally two kinds of plantar fasciitis, heel pain that I see in the clinic. The most common is pain right underneath the calcaneal bone or the heel bone. It's kind of forward where the plantar fascia will attach in there. The plantar fascia is a connective tissue that runs out, connects into the base of the toes. It'll stretch. That plantar fascia will stretch as the toes extend. It'll shorten as the toes flex. The other kind of heel pain that I see quite often in the clinic is pain on the sides of the calcaneal bone. Now, pain on the sides of the bone might not be plantar fasciitis, but it might have a diagnosis of plantar fasciitis. It's going to be addressed differently, and what you want to try to do as the patient is figure out if the pain you're feeling is due to connective tissue or due to other tissues involved. Meaning, could it be the bone tissue that's actually sensitive? Could it be the musculature that's sensitive? Could it be ligaments that are sensitive? Tendons connect muscle to bone, ligaments connect bone to bone. But there's going to be different structures in here, and you want to try to figure out what is the most tender structure that is affecting you, because it's going to require a different treatment strategy depending on the tissue involved. Now, all that being said, one of my favorite ways to work on plantar fasciitis sensitivity is with some simple cross-fiber massage. I'll use my thumb. I typically do it over the sock because the sock will allow me to kind of stick to the connective tissue in the skin, because I don't want to just glide over it. If I use lotion and on skin, my thumb will slide over the tissue. That's not what I want. I want to create some friction in there so that my thumb will stick to the connective tissue between the layers of skin, bone, fascia, and it creates a mobilization. I can feel the tissue move. I can feel some sensitivity in there. I can go parallel with the fibers, or I can go cross fiber. Both of them are going to be beneficial. I can also take the toes, go into a toe extended position, apply pressure, and then flex the toes so that I call it a flossing technique. But basically what's happening is I'm taking the connective tissue and sliding it under the pressure of my fingers. If you can't get good leverage with your thumb, you can use your other fingers. I do the same thing, apply pressure, I extend the toes, I flex the toes. I can extend the toes and provide longitudinal strokes. Now, to me, this feels horrible even when I don't have plantar fascia pain. I do not like the sensation of that longitudinal stroke through the arch, but some people do. If you're pulling down, kind of the same thing. I can apply like a 3 or 4 finger stroke, pulling down toward the base of the calcaneus, extending the toes while I do. This is a little more comfortable for me. Some of what we want to be able to do is make sure that the ankle mobility is intact. So your ankle should be able to roll in more than it rolls out. It should flex and extend. When you're pointing the toes, you should be able to get to at least 50, 60 degrees of what we call plantar flexion. As we bring it back, we should get to 10, 15, even 20 degrees of dorsiflexion. Just maintaining normal ankle mobility is an important element when we're assessing and trying to manage the symptoms related to plantar fasciitis.